So we're delighted now to welcome Dr. Andrea Gingerich, who's an assistant professor in the Division of Medical Sciences at the University of Northern British Columbia in Prince George, Canada. She's a health professions education researcher who studies how preceptors think while assessing, supervising, and maintaining boundaries with others. She's published extensively on how learning in clinical and health settings is navigated and assessed, and she teaches on the University of British Columbia's Northern Medical Programme and is a scholar with its Centre for Health Education Scholarship. So I'm just going to make you co-host there, Andrea, so you should be able to share your video there. Hi.
Hi, hello, thanks for the introduction. Thanks for inviting me. It's great to see that people have joined in today because I'm really honored to have the opportunity to discuss how we can better assess underperformance as we grapple with failure to fail phenomenon. I'm traveling for work right now, so excuse the boring background and fingers crossed that the internet connection holds up, but I did test it out and I think it should work. To increase accessibility for those who cannot see me, I'm a white woman of a certain age whose bone structure betrays my peasant heritage. I'm wearing glasses, my hair is mostly brown, at least on camera. For those who cannot hear me, I speak too quickly with a Canadian accent. And throughout the presentation, I'll be keeping an eye out for questions and comments as they come in because we have a bit of time at the end for discussion and questions. Thank you.
Great. Thanks, Andrea. That's a lovely introduction for yourself. Thank you. That's great. So we'll get started here with your presentation. So I'm just going to share here now. Great. And we'll get started. Actually, apologies. I'm going to stop sharing for a second just to make sure the sound is okay. One of my paranoid things.
I have no conflicts of interest to disclose, and the findings I share were funded through a Medical Council of Canada grant.
Apologies, it's freezing on me.
Underperformance is rare, but when it does occur, it presents a significant challenge for practice education coordinators. It's also a dilemma for supervisors and preceptors and a difficult experience for trainees. And of course, it can also be an expensive endeavor for programs. What raises the cost for everyone is when underperforming trainees are not formally identified and are instead allowed to progress too far without adequate support or modifications to their learning plan or path. If you've been involved with underperforming trainees, I imagine that you still carry with you vivid memories from that time. I know I do. And I want to invite you to bring some of those memories to the front of your mind now. So please just take a moment to reflect back on some of those experiences. I'm interested in how your experiences resonate with what I'll share today. For myself, I've had a few experiences from the different roles that I've taken on. When I've been assessing medical students, I've often felt like by the time I've figured out that someone was underperforming, it was too late to do anything about it. In a faculty development role, we would clearly describe the straightforward process for flagging an underperforming student. We'd even emphasize how it initiates extra support for them, and yet it's only used in the most extreme cases. And then, in a small leadership role, I felt some blame from subsequent programs when they feel our program has not failed underperforming trainees and now they are burdened with the challenge. Any of those ring true for you? Because those experiences fit well with common conceptualizations of failure to fail phenomenon. At some point in time, a trainee's underperformance becomes obvious within the training program and it needs to be dealt with. But there's a conspicuous lack of evidence. And so it's assumed that at least one supervisor knew that the trainee was underperforming, but they were too reluctant or even unwilling to complete the assessment like they were supposed to. We can look to the original failure to fail research to see some specifics of what supervisors are not doing but should be doing. They're not keeping sufficient notes to use as evidence from reporting underperformance, or they don't even know what evidence should be documented on the assessment form. Now, these are the sorts of things that could, at least in theory, be addressed by more or better faculty development. But you don't have to look too hard at this list to see how the design of the assessment system can provoke this misbehavior. It's just not reasonable to expect supervisors to flag trainees if there's no remediation for them, or if they themselves will come under fire during an appeal. It is this type of research that has stimulated monumental assessment redesign, including the shifts to competency-based, entrustment-based medical education, and programmatic assessment. But failure to fail phenomenon persists, and I find it fascinating, so we did some research. Today, I want to share with you what I've learned so far about assessing underperformance, and in doing so, I will offer a different perspective on assessing it. Since one of the things that I've come to learn is that failure to fail phenomenon can look different depending on which role you're in when you're viewing it, and I know we all wear multiple hats, I'm going to do something a little unusual. I'm going to direct some of my comments specifically to frontline supervisors, the people who are assessing the trainees, and I'll target other comments directly to those with leadership roles within the assessment system, like the practice coordinators or program directors or competency chairs or designers of assessment systems. Here's one of the things that I've come to learn that doesn't sound radical, but also doesn't fit well with approaches to assessment design. Supervisors are the instrument. One of my assumptions for our research is that it is the supervisor who is detecting underperformance in the workplace, not the form, not the assessment modality. Now, supervisors may communicate it through an assessment form, and the design of the form can support or interfere with that communication, but it is the supervisor who needs to make sense of what is going on, and I wanted to know how supervisors recognized underperformance. Because to my eye, most research on failure to fail has focused on the reporting and the documenting of underperformance and failure. So that phase that comes after underperformance has already become obvious, and when reporting could, should, and doesn't always happen. I was interested in the phase before that, the time when underperformance isn't yet obvious. In our research, we talked with dozens of physicians from multiple specialties about underperforming trainees, and we learned about their expectations for all trainees, which I've tried to illustrate here. They expected trainees to show up on time, prepared, to participate in experiences, engage with feedback and learning, apply that learning to the next experiences, and eventually move from a more simplistic or rudimentary version of what needed to be done to a more advanced or sophisticated version of it. They expected some trainees to progress more slowly, to need more time to learn things, to require more feedback, and so the slope of this line might be shallower or it might not be smooth. This was not underperformance. They expected all trainees to make mistakes and to do things incompletely and inexpertly because they are learning. That was just part of learning, and it was not underperformance. They also expected that every trainee would need extra feedback at some point in time, with a particularly difficult to learn skill or complex patient situation or complicated procedure or whatever it was. But that was not considered underperformance. They told us that it is underperformance when the trainee's progression stalls, despite having substantially increased the amount of supervision, teaching, feedback that they were giving them, and despite an increased number of opportunities to learn. It is underperformance when the trainee seems unable to apply their learning to those next experiences, or they seem unwilling to engage in the learning opportunities or feedback. For example, you may have gone over the steps of what needed to be done. The trainee can describe the steps, but they cannot seem to do what they said needed to be done, even after many opportunities and with cueing. And sometimes they don't even seem to realize that they're not doing it right. So how does this fit with your definition of underperformance? How well does it align with your experiences of working with underperforming trainees? So now I want to speak to the supervisors in the room. Why isn't underperformance detected earlier? based on our research, it's likely because you've learned through experience that those things that look like underperformance early on are almost never signs of an underperforming trainee. That most subpar incidents are really just blips. When you take a closer look, there's a reasonable explanation: an off day, a challenging set of circumstances, some distractions. And when you watch a little closer, you see that they're doing just fine. And so those early signs of underperformance don't always indicate an underperforming trainee. And you need to see a pattern of signs for it to be diagnostic of underperformance. But it takes time to see that pattern and to determine that you need to intensify your teaching and supervision and to monitor how the trainee does on those multiple attempts. And you may not be paired with the trainee long enough to reach that point. Now I'm going to turn to the coordinators and designers in the room. Our research supports the idea that supervisors initially detect underperformance by noting when something is inconsistent with their expectations. They do this by comparing the progression of this trainee to other trainees, and by comparing their supervisory experience with this trainee to their previous supervisory experiences. This isn't how they were asked to record the information on assessment forms. And if that's not the information that we can use for assessment purposes, then I think we can do a better job of helping them to bridge that gap. Second, supervisors give critical, constructive, corrective feedback to many trainees. It is not diagnostic of underperformance. And if you want supervisors to document that corrective feedback on assessment forms and to do it earlier than they do it now, I think you'll need to prove to them that this is for the benefit of the trainee and different from flagging underperformance. Next, I would not expect supervisors to score a trainee as underperforming or not on track or whatever language your form uses while they were in the process of recognizing underperformance. And this is because they haven't yet categorized a trainee as underperforming in their minds. So it would be strange to expect them to categorize a trainee as underperforming on an assessment form. Also, the larger body of research suggests that when you're speaking with supervisors who are in these early stages of recognizing underperformance, you can expect that they will put the trainee's learning as their focus. They'll give the trainee the benefit of the doubt, advocate for the trainee to get the help and support and teaching that they need. Perhaps they'll demonstrate some empathy, maybe even some pity for the trainee's struggle. Which brings us to the next thing that I've learned. Supervisors are people with real human emotions. They are people who build relationships with the trainee as a teacher, as a coach, a mentor, as a future colleague. And again, this should not be controversial, but it doesn't fit well with our approaches to assessment that need supervisors to be neutral observers or objective assessors. Even if we've been able to fool ourselves into believing that emotions are forbidden from assessment, they exist. And more than that, I think it could be possible for us to leverage them for assessment purposes. Supervisors, how could you leverage your emotions to report underperformance earlier? Well, what if you viewed yourself as a finely tuned detector of underperformance who is ready to spot the unexpected? This might mean that when you notice something odd or unusual while supervising, your instinct will be to pay attention and to get more information to be able to make sense of what is happening. This might be a good time to complete a low-stakes assessment or to take some notes on what it is the trainee is doing or not doing that is catching your attention. If you start to feel surprised, astonished, maybe even some disbelief that a trainee who has made it to this stage is not engaging with your feedback or applying their learning in the next experiences like you'd expect, how about describing their attempts in an assessment or in your notes? Because even though it might be too early to flag them or to have them failed in some way, this is unusual and likely the trainee could benefit from extra support within the program. Once you've noticed that you're investing significantly more time and effort supervising, teaching, giving feedback with the trainee is likely progressing more slowly than others. Might I suggest this is a sign that you're detecting some sort of underperformance, especially if your extra effort is not helping them to progress? If flagging them would bring in others to help, this might be a good time to do it. Here's another important thing to keep in mind. It might be frustration or anger that alerts you to the futility of your increased efforts. Don't take it out on the trainee, but instead take it as a signal to document what you've tried and how the trainee has responded. It's also likely a good time to see if there are any criteria that you could check to verify what this trainee should be able to do at this stage. If there is criteria, and this trainee has not been demonstrating that, consider reporting that this trainee is not progressing as expected. There's something else that came out of this research that you might find interesting. This is when you're about to reach the tipping point. A tipping point is a threshold where, after noticing many small changes, a complete shift in thinking happens. You recategorize things, go from good to bad, or stop to go. I predict that you'll feel certain that this trainee needs to fail if there is overwhelming evidence from multiple people in multiple situations over time, or if you discover that the trainee has made an egregious error, like a never event error, or if your suspicions are confirmed when a colleague from another service calls to tell you about an incident with this trainee that just makes everything click into place and you realize that they're really are underperforming. I want you to keep in mind that this is the point where you're about to switch from the role of a supervisor who supports the trainee, is on their side, gives them the benefit of the doubt, to taking on the role of a gatekeeper who steps in to protect patients and even the profession from the trainee by reporting their profound underperformance. It might take a lot to cross that threshold, but you'll know you're past it when you no longer have any doubts that this trainee needs to be flagged and you're ready to get others on board to take action too. Okay, back to the coordinators and designers. I want to talk with you about anger and tipping points. Anger is a moral emotion. We have it in response to noting wrongdoing or injustice. And it is a mobilizing emotion. It compels us to take action. Supervisors are likely to complete those assessments now. And you've likely heard of tipping points, and there's a science behind it. And that tipping point research warns us that under experimental conditions, we tip more easily than we realize we do, using less information than we think we do. And here's the potential problem for assessment of underperformance. Both tipping point and anger research warn us that we may not be able to see improvement once we have verified failure. There are various things at play here, but the bottom line is that we are at risk of not being able to note signs of improvement even when they're there. And it's likely that this is the sort of thing that we can't overcome just by being aware of it and extra diligent in avoiding it. So we need to have checks and balances within our assessment systems to accommodate this. I take this as a warning. We have prioritized solutions for failure to fail phenomenon, and appropriately so. But we also need to prioritize solutions for, I guess we could call it, failure not to fail phenomenon. How might we do that? Well, let's start by asking ourselves what is in place right now to detect improvement during remediation or after a trainee has been labeled as underperforming. For example, is there a way to get fresh eyes on the trainee's learning? Do we construct a learning plan with specific targets before they start remediation and then compare their demonstrated learning to those targets? What else could be done to ensure that we can detect improvement when it's there? This has been a quick look into what I've learned so far about assessing underperformance. I continue to see failure to fail as a phenomenon that needs to be addressed, but I'm not comfortable placing too much blame on supervisors because our systems can be designed to invite such misbehavior. I also see systems as something that can be redesigned to make better use of the strengths of supervisors as people. To tie it all up, what can we do with these ideas to improve the assessment of underperformance? I've included a picture here of a Canadian cutting a cake with a MacBook computer because it made me think, are we using supervisors to their fullest potential to detect and report and remediate underperformance? Because sometimes I wonder if we're overlooking their vast capabilities and using them in place of a knife and then blaming them for being too thick and dull. I wonder about the various ways that workplace-based assessments could look if we were to custom build systems and processes and forms to harness the strengths of people, our humanness, our expertise, and to do it within the real and unavoidable constraints of the workplace. But to do that well, we need to know what supervisors can do, how they can do it, and how they can be supported to report what they can detect. There are assessment conditions where we can remove much of the assessor's humanity. I'm looking at you, Waskies. But what would workplace-based assessments look like if we were to design them to leverage the humanness and expertise of supervisors as people? I don't have a clear picture of what this would look like, but as you enter into further conversations on how to optimize the assessment of underperformance throughout the rest of this conference, I offer 3 take-home messages to keep in mind. First, I purposefully spoke to supervisors and coordinators separately today, even though I know many of you are both, because that is often what we do in assessment and faculty development. Those roles do have different goals and priorities for assessing underperformance, but I encourage you to work cohesively by acknowledging those differences and examining the problems and solutions from each of those points of view. And then to anticipate that there will need to be some give and take between what leaders need the assessment to do to meet their mandates and what information the supervisors can actually provide. Coordinators. The supervisors can't give you the information that they don't have yet. And when the majority of your supervisors are misbehaving, take a look at how reasonable your requests are, given the specifics of that situation. Supervisors, the coordinators need information to make decisions and then to defend those decisions. If you can't give a judgment on the trainee's performance, could you give a description of it? Second, and related to that, the information that is available is connected to the amount of time available. So for the best quality of information, keep those in alignment. Coordinators, if you are asking supervisors to report which trainees are underperforming, they will need enough time with the trainees to note patterns and to cross the threshold of the tipping point. If the length of rotations or the duration of the relationship between the supervisor and the trainee cannot be changed, then align data collection with the information that they could provide. If it's a short interaction, then it would be more descriptive information, like examples of the trainee applying feedback into a subsequent similar learning experience. Supervisors, be clear about what information you can provide and when you can provide it. Third, I highlighted some potential problems with striving for earlier detection and reporting of underperformance. Let me be clear. I agree that delayed identification of underperformance is a problem, but earlier identification invites a different set of problems. For example, you'll have more false positives to deal with, so you'll need processes in place to determine who is actually underperforming, and you'll end up needing to support more students in difficulty if you have more students identified earlier. I encourage you to take an honest investigation of which trade-offs are best for your context. Perhaps it makes more sense to focus your efforts on a different phase of assessment, like your remediation streams or the robustness of your dismissal processes. And finally, I've come to learn that supervisors' lack of confidence early on can make reporting underperformance difficult and delay the identification of underperforming trainees. But once they do become sure that the trainee is underperforming, they can have difficulty seeing improvement. So I now realize that I can't promote earlier detection of underperformance and earlier reporting of failure without also ensuring that we have processes in place for the detection of improvement after a trainee has been labeled as underperforming. Failure to fail deserves our attention, but so does failure not to fail. And as I close, I wonder if I've convinced you that there is more to failure to fail phenomenon than raters being reluctant or unwilling to fail a failing trainee. And with that, I'm eager to answer some questions and respond to your reactions.
Wow, gosh, that was a wonderful presentation. Oh, sorry. There we go. There I am. That was a wonderful presentation, and I think your final comment there of, have you convinced us that it's beyond just a reluctance to fail, certainly for myself, I'd say absolutely. That's really interesting how that's been presented. So thank you, Andrea.
Thanks for that. Yeah, like the hesitancy, reluctance, unwillingness, it's certainly part of it. We have lots of research. We ask people when it comes to putting this down on paper or reporting it even in informal ways, it's difficult and we have lots of reasons. So I'm not saying it's not that. I'm just saying even if we completely fix that and everyone was willing to put it down, that there's still some other things that that could get in the way of us doing what we think we'd be able to do.
Yeah, absolutely. And I think one thing that was really interesting, I think the emotion side that you were raising, and even the words used there, maybe surprise or astonishment or frustration or anger, and kind of noting, as you say, trying to describe attempts. Would you say that that's a good strategy for a practitioner in terms of trying to almost distance the emotion a little bit? Because normally what we put down on paper will be a less emotive, I suppose, description of what's happening. Is that a good strategy for boundarying the situation, would you say?
I think the emotions could work well as a sign to us, as a motivation to start engaging in some of our assessment activities, to use that as we're picking up on something, and then be like, okay, have I done a workplace-based assessment lately? Have I taken some notes? If you tend to do more of those high stakes assessments later on, do I have some of these details of what I'm noticing? To do that in the assessments, I'm not sure how helpful it is for us to put down our emotions as part of the assessment comments. And I don't think it's the direction we want to go for our rating scales to identify our own emotions, right? I think it's just more of this, to use them as a sign that we're picking up on something, and to pay more attention, and then actually to get things down on paper. I think it's more at that stage that we could use it, because it does seem to be quite telling that, just picking up that this is unusual, this is strange, odd. These are some of the words that we got when people were telling us when they were first identifying an underperforming trainee, and then it took quite a while before they got to that stage where they're like, oh yeah, this is definitely underperformance. This isn't just a couple bad days or some things going on at home.
Yeah, absolutely. And I think I'm just seeing a comment come in there. I'm particularly, and it's interesting as well. Yeah, I think that point around the detection of improvement is so important, because I suppose once a student gets the label of maybe struggling or being at risk of failure, it can be hard to shake that off. And I think it's just so important that that piece on detection of improvement is essential. Just from Anne Maria there, any advice on how to continue to recognize the small improvements even when you've reached that tipping point?
Yeah, so I think this is going to be key, and I'm not sure, we haven't talked about it a lot. So I think by putting it on our radar, we can look and see what processes do we already have in place that we think are working to do this, and for us to investigate a bit more on what we need that we haven't been doing, because I don't think we've fully recognize how important this might be. Fresh eyes could be one way. So the people who are heavily involved, especially the longitudinal relationship with the trainee, it seems like it would be most difficult for those people to see improvement if it was there, especially right away. So maybe even if they had a break and then came back, it might help. So having other people look in another place. I think we need to get to the point where we do something to lose that stickiness of the labels of underperforming or failing or in remediation, that this is just that we expect it. So it might be a bit of a culture change in the norms. Things like, we expect that most students are superb in our programs and they would do well no matter what we did with our curricula. As long as we gave them exposure to learning opportunities and good preceptors, they're going to learn what they need to learn. We do extra, we put a lot of effort into how we help them learn, and it's going to work for most of our trainees, but we know it's not going to work for everyone. So if we kind of get that out there, say we know there's some this isn't going to work well, we have enough resources to put a little bit of extra customization for those students, tell us who those people are, and then we'll do it. And this doesn't mean that we're going to kick them out of the program. We're just going to redesign things a little bit that works better for them. And then we also know there's just a very small percentage that this isn't for them, and it takes them a bit to recognize it. Help us figure out who those students are so we can help them move on to what fits better for them. I think part of that I think would be helpful, and then setting up our systems that we can get that early recognition that gets the trainees support. So it's not just the label, it's the things that kind of go unseen, don't go on the permanent record. I will make sure you're with a really good preceptor, or make sure you're at the best learning opportunities for what you need. I think if we start to do these things, like this is just a normal expectation, we know we have this, hopefully that helps with this sign of we expect most trainees to improve when we do these things. So let's look for that improvement. And then it's only the default is that they're going to improve. And then we really need evidence that they're not improving. Some things like this, but again, this is not research based. This is just looking at what programs have been doing so far and seems to be working.
Yeah. And actually, can I just ask, in terms of the fresh eyes piece, because I suppose sometimes the person who's sometimes best placed to provide the bigger picture of maybe the ups and downs is the person who's had the student the longest. But as you say, they can then they can become more shuttered or their view more narrow because of maybe that length of time that they've spent with the student. I suppose if you had someone, if you were bringing in fresh eyes, what would you tell them and what would you not tell them in order not to bias their view before they assess the student? How would you manage that?
Very controversial, and there's conflicting evidence on this as well. So whether you call it forward feeding or learner handover, there's the pros of if you let people know, they can better address how they're supporting the trainee instead of needing to figure it all out on their own and lose time. There's concern that it will bias them if you tell them too much. I think once a trainee gets to that formal remediation process, they're known. It's pretty rare. Even, our medical school, it's 288 students per class, you still know, right? So I think we're fooling ourselves if we're keeping it secret, because there's the underground of who's having trouble, especially when it's at the stage where there's more service provision, because it affects work teams. I think people are going to know. I would hope that we try to look for improvement, hope they're going to improve. We may need remediation teams or people who specialize in it. That seems to work in some programs, that they have that view of they're looking for standards, let's give them an opportunity, support, those sorts of things. The conditional pass systems that some places have, Tim Wilkinson in New Zealand has mentioned this years ago. Really getting specific at the beginning. It helps prevent those shifting standards. Like, what exactly should you be able to do? Let's give you lots of opportunities to do that and get feedback. And then we need the people who could see how you're performing. So I think it's a solvable problem. And I just hope by putting it, more front of mind that we can work on it a bit. Sorry, I can see this chat rolling beside me, but I haven't keeping up.
Yeah. Just, I think one of the earlier ones there from Claire, would you advocate, this is kind of related, flagging up a struggling student in advance of a placement to aid earlier detection of the underperforming student? So perhaps a student that has struggled previously or is struggling on the college program but passing, would you flag that with the placement setting in advance?
I think these are the really important conversations to have with your program. So our programs are also different, and whatever you choose, there's going to be a downside to it. So then having something in place to accommodate what's the downside of doing that. So if you don't have this learner handover, then people need to figure things out again. So you're going to have time for that. And then you're decide, am I going to compare it? Are we going to keep this hidden and then compare and see if there's this verification? That process is in place because psychometrics often is the way we set up our assessments. And the assumptions for psychometrics will give us better data if we have independent samples and viewpoints. So that kind of independence, like keep everything separate, then we can get that verification and reliability. If it's not set up that way, it doesn't have to be, then that learner handover and trying to get that, the same as with a patient, you're following up. So if we think of it as a patient, we wouldn't just lock on to the previous diagnosis and treatment. It would color what we're doing, but we've been taught you need to get your own fresh. Now you're responsible for it. So you need to do your own due diligence, and you might have a different diagnosis. And that doesn't necessarily mean that the first one was wrong. Maybe things have evolved, maybe it's related, maybe it's, all those sorts of things. So maybe that's a way to think about it if we are doing some learner handover.
Yeah, that's actually a lovely analogy. Yes, in terms of patients. Just seeing a comment here from Karina, fabulous presentation. The length of exposure of students to supervisors and the specific learning environment is definitely something that is a struggle to allow the students to improve. So length of exposure and the environment itself. Do you have any thoughts on length of placement or exposure that might work better to allow improvement to happen?
I don't have the magic number. If that's, I would give it to you if I had it. I think the things to keep in mind when we're setting it up, if we have the flexibility to do whatever we want, those long relationships are great for feedback. They might not be the best people to do the high level assessment. So if we think of them more like coaches, if we want our trainees to be vulnerable and open to feedback and admit their limitations and work on it more like an athlete would work on it in practice. Yes, that person is judging how well they're doing, but they're more trying to get them up to that level they can perform and be and do really well. Then we would want to have other people who had long enough to interact with that trainee to have more of those judgments. So yes, they'd be that might not be as thorough or complete, but if you think of it again, kind of in sports, so this is a bit of your competition. You're going to go out. Maybe it's an off day and it's not the best representation. You're going to get some representation, and we keep doing these along the way, get a different perspective on it, and through these processes, kind of the trade-off. So I do have concerns about combining, feedback and formative assessments with summative, high stakes assessments. It makes it messy for the trainee. It makes it hard for the supervisor to write down comments that are both feedback and speaking to the trainee and are assessment judgments that are speaking to a program director or competency committee. So just kind of spaces where we can separate those. I think we could get better quality assessment data and also get better quality feedback conversation moments.
So there's that little bit of more distance or clarity between certain elements of the assessment. That's really interesting. Just another question here from Claire. Is there any research that detecting underperformance is more difficult to detect in early years? So students in maybe the first and second year of an undergraduate program, is it even more difficult to detect underperformance the earlier on the students are? Just saying this is something we often struggle with.
I don't think there's specific research on that. It's more difficult, but our research gave some of those ideas of why you might not be able to do it earlier, is that you just need that pattern before you're sure. So either we ask for assessment data that's different than having someone indicate, check this person's underperforming, not meeting expectations. That might be too much. Early on, you really give them the benefit of the doubt and you worry about it being your own, like you don't trust your assessment, especially because rarely they're performing so badly everywhere that it's really obvious early on. It's usually kind of, well, they're good at this, but not at it. And I kind of wonder, so what can they tell you at that point? So maybe looking at your program and looking backwards, retrospectively, and be like, well, how is it showing up? How can we get people to tell us this? And this is where I'm most involved with small group learning. I know it's very different than the workplace, but there's similarities in that we really ask our tutors to tell us early on, just so they have any inkling of someone who either it doesn't, small group learning, we've done PBL, we've done CBL, if it's not fitting all that well for them, just let us know. We're going to change. We're just going to tweak some things to try to help them out. Or if you think they're not putting things together as well as they should, again, let us know. We're just going to set them up with the best tutor we have in a group that doesn't have someone else who's acting out. We're just going to give them the best chance, wait a bit more, collect more data. Often it isn't anything. We just help them out. And when it is something, we start to get more and more sure. But at least we have our eye on them at the program level. It's this, when it's hidden and it's like there was murmurs, and if you're not in those hallway conversations, you don't know until it's quite advanced. Like trying to get rid of that, whatever makes sense in your program. Again, I think we need to capitalize on our preceptors are helping people. We went into this as helpers. So if we prove to them we are helping trainees, when you give us this information, we're not punishing them, and we're not trying to force them out prematurely, that I think they're more likely, and that will take a bit of time to earn their trust if we've done things in the past that makes them feel like it's all on them. They get blamed, it risks their teacher evaluations, it causes problems for them. Then to me, it's completely rational that they're not going to tell us until they absolutely have to protect the safety of current and future patients in the profession.
Yeah, absolutely. And just last one there, because we're coming close to time, but what's your perspective briefly there on failure measures with regards to teamwork, practicing respect to colleagues and working in the clinical environment rather than failing sort of an exam or task or maybe technical skill, in terms of maybe those softer skills? What kind of measures of failure? Do you have any thoughts on that, just briefly?
Sorry, instance that was on how it's affecting teamwork and
Yeah, your perspective on failure measures on teamwork, practicing respect to colleagues, and working in a clinical environment. So where students aren't failing on like completing a technical skill, and maybe that's very well defined, but instead are failing on just how they interact with
those
others.
professionalism issues. Thanks.
Yeah.
Okay. So they're tough, obviously, because it's easier when you can point to a test and say you didn't pass by these numbers, or here's an OSCE and you didn't do it. I don't have the magic answer. I do think writing down incidents and getting descriptions of them. So instead of having, it sounds less defensible when you just get that judgment part. It was unacceptable. They were disrespectful. At that level, you're like, okay, but getting those early, like, here's a situation I'm going to describe that you're picking because you felt like they came across as entitled or rude or all these things that you can't actually put in assessment comments. Describe it so others could understand it, so that they could be in that situation. Use voice to text if it's going to be too long, but give those details. If we get enough of those stories collected over time, and have evidence of here's where we intervened, here's the brave coordinator or supervisor who stepped in and said, you know what, I want to point out some ways that you're coming across on the team. It may not be what you were intending, but let's have a conversation on how you could change. And you mark this over time. Here's what we're seeing. Here's an incident. Here's people, we have this eyewitness testimony of what's going on and these points where we tried to help you with it. That can stand up in an appeal, because of course our assessments, it often comes down to the appeals. It's not so how robust your assessments are, but showing that they've been told, when they've been told, how they were told, what opportunities they had to improve, and then evidence of if they're improving or not. So it's probably more on that kind of a level, I think, so that a judge, the profession, they can look at all these snippets and be like, oh, we can get the flavor, and then you don't have to name your interpretation of what you thought that was and how it was disrupting the team. You can give evidence of it takes twice as long to do this when they're on the team, or whatever you can get that kind of gives someone else a feel.
Yes, yeah. I'm pulling it down to some maybe very tangible impacts of some of those behaviors. Yeah, as you say, because the labeling is challenging. But that's a fantastic presentation. I really appreciate it, Andrea. And yeah, on behalf of everyone here, I think everybody found that very insightful and useful from the comments. I don't think we could even get to them all, but thank you so much. I'm sure you're happy for me to issue the recording just to everyone there next week. But yes.
Yeah, thanks for inviting me.
No problem at all. Thanks very much. I know it's so early over there, but you're very good for linking in. I really appreciate it, and enjoy the rest of your day.
Thank you.
Thanks a million. Take care.